I'm Dr. James Whittaker. And what does the size of your testicles really mean? It's a question that countless men think about privately, but rarely ask out loud. Does having larger testicles mean you're more masculine? Does it indicate higher testosterone levels? What about fertility potential? The questions every man wonders about. These are completely valid questions that are unfortunately surrounded by massive amounts of myths and dangerous misinformation. So today, we're going to cut through all the noise and confusion to get straight to the medical facts. We're going to explore what testicular size can tell you about your health, and just as importantly, what it absolutely cannot tell you, based entirely on rigorous medical science and decades of clinical research. By the end of this comprehensive guide, you'll have a clear, accurate understanding of this fundamental aspect of male anatomy. After treating thousands of men over 2 decades, I can tell you that testicular size anxiety is far more common than most people realize, and the misinformation circulating online is causing unnecessary worry and poor health decisions. Understanding the dual factory system. To understand what testicular size actually means, we first need to be completely clear about the 2 primary jobs that your testicles perform every single day. Think of each testicle as a highly specialized biological factory containing 2 completely different production lines, each with a distinct and crucial purpose. The first production line is dedicated to spermatogenesis, the incredibly complex process of creating millions of sperm cells. This represents the fertility function, the part of the biological factory dedicated to ensuring species continuation and your reproductive potential. The second production line focuses on hormone production, specifically manufacturing testosterone, the primary male hormone responsible for everything from your sex drive and muscle mass to your bone density, mood regulation, and overall masculine characteristics. The critical space allocation is secret. Here's what most men don't understand. These 2 vital functions happen within the same organ, but they're carried out by completely different types of cells and occupy vastly different amounts of internal space. This difference in space allocation is the absolute key to understanding the relationship between testicle size, fertility, and hormone production. Most men assume that larger testicles automatically mean more testosterone, but this assumption is completely wrong and leads to unnecessary anxiety and poor health decisions. The fertility connection, where size actually matters. Let's start with the area where testicular size has genuine medical significance: fertility and sperm production capacity. When we discuss testicle size or volume, we're really talking about the amount of internal reproductive machinery contained within each organ. Here's the crucial fact that changes everything. Approximately 95% of total testicle volume consists of structures called seminiferous tubules. These tubules represent the actual sperm production assembly lines. Thousands of tiny coiled tubes where sperm cells are created, developed, and matured over a 74-day cycle. The specialized cells lining these tubules, called germ cells, serve as the raw biological materials that eventually transform into fully functional sperm capable of fertilizing an egg. Subscribe to the channel right now. If you're finding this scientific information valuable, I share evidence-based men's health content every week that could transform your understanding of male anatomy and health. Hit that subscribe button and notification bell so you never miss crucial medical information. Because sperm-producing machinery comprises the overwhelming majority of testicular volume, there exists a very strong and direct correlation between testicle size and sperm production capacity. The analogy is straightforward. A larger factory contains more space for additional assembly lines, and more assembly lines equal higher potential production output. Similarly, a larger testicle contains significantly more seminiferous tubules, and therefore possesses greater physical capacity to produce higher quantities of sperm. Conversely, a smaller testicle, having less internal reproductive machinery, naturally has reduced capacity for sperm production. This isn't merely theoretical. It's a fundamental principle in reproductive medicine that urologists use daily for patient assessment and treatment planning. Clinical applications in fertility medicine. When couples face conception challenges and seek medical help, One of the very first assessments a urologist performs during physical examination is measuring testicular size and volume. Smaller than average testicles, a condition medically termed testicular atrophy, represents a significant red flag for potential sperm production issues. A classic medical example demonstrating this size-fertility relationship is varicocele. A varicocele consists of enlarged, twisted veins within the scrotum, similar to varicose veins in legs. These abnormal veins cause elevated temperatures inside the testicle, creating a hostile environment for sperm production. Let's take the varicocele example. Over time, this chronic heat stress damages the sperm-producing tubules and causes them to shut down progressively. When tubules stop functioning, the testicle physically shrinks or atrophies because the non-functional tissue is gradually replaced by scar tissue. The result is a visibly smaller testicle accompanied by dramatically reduced sperm count and quality. This example perfectly illustrates how testicle size directly reflects internal reproductive capacity and overall fertility potential. So our first crucial takeaway is this: testicular size serves as a strong and medically relevant indicator of your body's potential for sperm production. Larger volume generally suggests higher fertility capacity, while significantly smaller volume can indicate compromised sperm production requiring medical evaluation. If you're trying to conceive and notice that your testicles seem smaller than normal or have decreased in size over time, this represents a valid medical concern that warrants professional evaluation, typically beginning with comprehensive semen analysis. The testosterone myth, where size doesn't matter. Now let's address the second testicular function, testosterone production. This is where the most persistent and damaging myth exists, and it's absolutely crucial to separate medical fact from popular fiction. Many men incorrectly assume that since larger testicles produce more sperm, they must automatically produce more testosterone as well. This assumption is medically incorrect and leads to significant anxiety and poor health decisions. The relationship between testicle size and testosterone production is extremely weak to the point of being clinically unreliable for assessment purposes. Understanding Leydig cell function. To understand why size doesn't predict testosterone levels, let's return to our biological factory analogy. We established that 95% of factory space is dedicated to sperm production assembly lines. So where exactly is testosterone manufactured? Testosterone is produced by specialized cells called Leydig cells, which are scattered throughout the small interstitial spaces between the sperm-producing tubules. Here's the critical point that most men don't understand. These testosterone-producing Leydig cells comprise only about 5% of total testicular volume. Because Leydig cells occupy such a tiny fraction of overall organ space, testicle size tells you virtually nothing about how many Leydig cells you possess, or, more importantly, how efficiently those cells are functioning to produce testosterone. You can have very large testicles packed with sperm-producing tubules, but possess relatively few Leydig cells that aren't functioning efficiently, resulting in low testosterone levels despite impressive testicle size. Conversely, a man can have smaller than average testicles, but if his Leydig cells are highly efficient testosterone producers, his hormone levels can be perfectly normal or even above average. The efficiency of Leydig cell testosterone production is primarily regulated by hormonal signals from your brain's hypothalamus and pituitary gland, not by the physical size of the organ housing these cells. It's fundamentally about cellular quality and efficiency, not quantity or available space. Leave a comment below and tell me if this information has changed your understanding of the relationship between testicle size and male health. I read every comment and often provide detailed responses to help clarify complex medical concepts. Also, share what country you're watching from. I love connecting with men worldwide who are seeking accurate health information. In my practice, I've seen countless examples that demonstrate this size-testosterone disconnect. I've treated men with impressively large testicles who struggled with low testosterone symptoms like fatigue, decreased libido, and mood problems. Conversely, I've had patients with smaller testicles who maintained excellent testosterone levels and robust masculine characteristics throughout their lives. The key determining factor is always Leydig cell function, which can only be accurately assessed through comprehensive blood testing, not visual inspection or size measurement. If your concern involves potential low testosterone, focusing on testicle size will be completely misleading and counterproductive. The reliable indicators of low testosterone are clinical symptoms and laboratory blood tests, not anatomical measurements. Real low testosterone symptoms include persistent fatigue that doesn't improve with rest, noticeable decline in sex drive and sexual interest, difficulty achieving or maintaining erections, progressive loss of muscle mass despite exercise, increased body fat accumulation, mood changes including depression or irritability, decreased motivation and mental energy, and reduced bone density leading to fracture risk. If you're experiencing multiple low testosterone symptoms, testicle size is completely irrelevant to your diagnosis. The only definitive way to assess testosterone status is through comprehensive blood testing, measuring total testosterone, free testosterone, and related hormones. These blood tests should be performed in the morning when testosterone levels are naturally highest, and abnormal results should be confirmed with repeat testing before initiating any treatment protocols. Let me address some persistent myths that create unnecessary anxiety among men. Myth number 1, larger testicles always mean higher testosterone. As we've established, this is medically false because testosterone production depends on Leydig cell efficiency, not organ size. Myth number 2, small testicles mean you're less masculine. Masculinity is determined by hormone function and psychological factors, not anatomical measurements. Many highly masculine men have smaller testicles with excellent hormone production. Myth number 3, testicle size determines sexual performance. Sexual performance depends on blood flow, nerve function, psychological factors, and overall health, not testicle dimensions. It's normal for testicles to gradually decrease in size as men age, typically beginning around age 40. This natural aging process doesn't automatically indicate health problems, but significant or rapid size changes warrant medical evaluation. Age-related size reduction usually reflects decreased sperm production capacity rather than testosterone problems, though both functions can be affected by aging, underlying health conditions, or lifestyle factors. You should consult a healthcare provider if you notice significant changes in testicle size, especially rapid shrinkage or asymmetry between sides. Other concerning signs include lumps, hardness, pain, or swelling that doesn't resolve quickly. For fertility concerns, seek evaluation if you've been trying to conceive for 6 months without success, especially if you notice smaller testicles or other reproductive symptoms. For potential testosterone issues, focus on symptoms rather than size, and request comprehensive hormone testing if you experience multiple low testosterone symptoms that affect your quality of life. Understanding testicle size in proper medical context helps you make informed health decisions based on science rather than myths or anxiety. Size provides valuable information about fertility potential, but tells you virtually nothing reliable about testosterone production or overall masculinity. Your testicles are remarkable organs performing 2 completely different but equally important functions. Respecting their complexity and understanding their true capabilities helps you maintain better reproductive and hormonal health throughout your life. Regardless of your natural testicle size, certain lifestyle factors support optimal function of both sperm production and testosterone synthesis. Maintaining healthy body weight reduces estrogen production that can suppress testosterone and impair sperm quality. Regular exercise, particularly resistance training, supports healthy testosterone production and overall reproductive function. Avoiding excessive heat exposure protects sperm-producing tubules from thermal damage. Managing stress through relaxation techniques, adequate sleep, and healthy coping mechanisms supports optimal hormone production and sexual function. Specific nutrients support both testosterone production and sperm health, regardless of testicle size. Zinc is crucial for testosterone synthesis and sperm production. Good sources include oysters, beef, pumpkin seeds, and legumes. Vitamin D supports testosterone production and overall reproductive health. Most men benefit from vitamin D supplementation, especially during winter months, or with limited sun exposure. Antioxidants like vitamin C, vitamin E, and selenium protect sperm from oxidative damage and support healthy testosterone metabolism. Focus on symptoms and function rather than anatomical measurements when assessing your reproductive and hormonal health. If you have fertility concerns, seek comprehensive evaluation, including semen analysis and hormone testing. For suspected low testosterone, request thorough blood work measuring multiple hormone markers, and don't rely on testicle size for assessment. Maintain healthy lifestyle habits that support optimal testicular function regardless of your natural size. And don't let anxiety about normal anatomical variation affect your confidence or self-image. The relationship between testicle size and male health is nuanced and specific. It's not about masculinity, self-worth, or vague concepts of manliness. It's about understanding two distinct biological functions that happen to occur within the same organ. For fertility assessment, testicle size provides valuable clinical information because sperm production machinery occupies most of the organ's volume. For testosterone evaluation, size is medically irrelevant because hormone production occurs in a tiny fraction of total testicular tissue. Remember that testicle size tells a medical story, but you must know how to read it correctly. It's primarily a story about fertility potential, not testosterone production. Larger size suggests greater sperm production capacity, while smaller size may indicate reduced capacity. When it comes to testosterone, the real story is written in how you feel, your clinical symptoms, and ultimately confirmed through comprehensive blood testing, not visual assessment of organ size. Don't rely on myths, misinformation, or visual guesswork to assess your health. If you have concerns about fertility, hormones, or any aspect of reproductive health, consult with qualified healthcare professionals who can provide accurate testing, proper diagnosis, and evidence-based treatment recommendations. I'm Dr. James Whittaker, and my mission is providing men with accurate, science-based health information that reduces anxiety and improves understanding of normal male anatomy and function. If you found this information helpful and clarifying, please give this video a thumbs up and subscribe for more evidence-based men's health content. What questions do you have about male reproductive health? Leave them in the comments below, and I'll address them in future videos.